HIV Alliance has a syringe exchange program, and they noticed that there were pretty high levels of vaccine hesitancy for COVID-19 among their clients, and were curious as to why that might be. I volunteered for a year and a half there before I started my project, and that's sort of what prompted my thesis research. I wanted my thesis to be actionable. The World Health Organization sort of attributes vaccine hesitancy to three main categories: confidence, complacency, and convenience. But I felt that this population needed something more specific. I have some quantitative data from the Prevention Science Institute's surveys that I drew data from. I also did about 42 interviews myself at various syringe exchange locations. I actually found 5 different categories that have prompted people who inject drugs to feel less confident in getting a vaccine. There's confidence in the government and healthcare facilities because they faced a lot of past discrimination. There's community implications. A lot of the people that I interviewed referenced what they had heard from other people. Then there's whether someone is actually able to access vaccine services due to time or transportation or other perceived barriers to care. There's also communication, so whether they're able to access information related to vaccines that make them feel comfortable in getting one. Then there's urgency, so how much they actually see COVID-19 as an issue if there's other things that are more pressing like food or housing instability, and it's not necessarily at the forefront of their minds. One of the most important things that I wanted to get out of the interviews was telling the personal narratives that sort of inspired people to either get vaccinated or not get vaccinated. It's a very under-researched community, and that's something that people don't really focus on very often. What I'm most proud of is that I'm going to be able to hopefully portray people's actual stories rather than just coming in as a researcher and saying, this is how they feel.